everyone. Welcome to the Happy Flosser podcast. My name is Billy Luntz, and I'm your host. I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. And in today's episode, we're going to talk about the connection between oral anatomy, dental anatomy, where you have to learn all about the root anatomy and the tooth morphology of each tooth type in the dentition. And then also in your studies, in your curriculum, you'll take your perio course. And then in the clinical setting, you are charged with combining those things together to really do critical thinking, to determine the health status of your patient and come out with a prognosis or outcomes assessment for your patient, especially if they present in the clinical setting with disease. So what I want you to think about is I want you to think about because what I teach oral anatomy, and one of the things that students ask, and someone will ask every single time I teach this course, why do we have to understand so much detail about the roots? Well, that's such an important question. So I want you to think of the root trunks like the foundation of the house. And if that foundation of the house is, giving you trouble or has different, if it's short, right, problems will show up sooner, I guess is the way. Or if there's a lot of variability, there can be some challenges that you face. So those root trunk lengths really shape your treatment decisions, but even more importantly, your ability as a clinician to support your patient to have really good outcomes. And that can be really tough. So I'm just going to start with some of the content. So I have a study notes book that I've developed. It's a perio study notes book. Here it is, Periodontology. It is a little over 100 pages of handwritten notes. And in this study notes book, this covers your perio course and all of the disease classification. I've had many hygienists out in the field who have purchased this book just so that they have it. It's a great resource and reference for you. And in that book, in that study notes book, I've taken the time to actually connect the dots for you between perio and your oral anatomy course. So let's talk about this. So you've probed your patient, right? Now what? So you need to have a really good understanding of root trunk lengths when you probe your patient, because the gingival tissue and the inflammation that's present on your patients can sometimes obscure those landmarks, making it really difficult to visually estimate the root trunk length. So you have to know what that root trunk length is. The other thing is that our radiographs that we rely on, they're taking a three-dimensional object and they're putting it on a two-dimensional image. So it doesn't clearly show the root trunk anatomy, especially on those maxillary molars, those multi-rooted teeth. And we have to know that there's concavities even in the furcal areas and what those actually look like and get like a strong visual of the anatomy. Sometimes we can see when we already know that there's typically a root concavity. Like, for example, on the mandibular first molars, we know that there's a mesial concavity that comes up past that CEJ onto the crown of the tooth. And we can look at that on the radiographs so that we can identify if somebody has like greater variability there so that we can be mindful of what we see as a potential issue for that patient. So when we have anatomical variations, we know that there can be some challenges for our patient. But for you, you have to have strong anatomical knowledge between those tooth types, like the molars versus the premolars, because there can be significant differences between those. And so you have to know all your root trunk lengths by heart before you even set foot in the clinical setting and work with your patient. So just looking at the mandibular molars, right? We know that there are two roots on the mandibular molars, which means that because there's two roots, a mesial root and a distal root, there will be only one furcation. And that furcation is located on the buccal and the lingual surface. So you can access that furcation on the direct buccal and the direct lingual surface. And access and instrumentation is challenging with our patients. Those deep pockets and furcation involvement can really make probing a little more complicated, and the angulation of your instruments may limit your ability to access those regions to really support your patients. And that's why when our patient has early furcation involvement, we know that their disease progression is more significant. And in early disease, as a clinician, the reason why it's so important for you to understand those root trunk lengths is because you want to detect disease at the earliest sign. Because in early disease, bone loss may not expose those furcations on the radiographs, making it really hard to relate the root trunk length to that current periodontal status of your patient. So we do know that there's variations, right, with interpretation for patients. So the root trunk lengths give us a general rule so that we have a heightened awareness of our patients. So a shorter root trunk length means that furcation involvement occurs earlier with bone loss. And while that can be a disadvantage, right, on a reduced periodontium for our patient, long root trunk delays furcation exposure. So maybe a patient could have some recession and still be okay at managing the outcomes or the prognosis based on their anatomy. So their anatomy could actually work for them. The key for you is to know what those root trunk lengths are so you can determine if your patient actually has a shorter root trunk or a longer root trunk. Because a shorter root trunk, they have a higher risk of early furcation involvement, which complicates treatment. And a longer root trunk, there's more bone support before furcation exposure. But once exposed, that prognosis may worsen due to deeper involvement. So that's something you want to keep in mind. So let's just go over the basics. So the mandibular first molar, the buccal root trunk length is 3 millimeters. So that means from the CEJ to the furcal crotch is 3 millimeters. So if you are probing on the buccal aspects and you get a 5 millimeter pocket on the direct buccal, you are into the furcation region. So that determines whether or not your patient has periodontal disease, if there's furcation involvement. And like I said, it's really hard to look at the radiographs and make that early detection sign. So those are things that it's really important for the hygienist to be able to explain to patients why some teeth are more vulnerable, reinforcing that education on the importance of maintaining and also for us to be monitoring. The mandibular second molar, the buccal root trunk, is 4 millimeters from the CEJ to the furcal crotch on the buccal. On the lingual, and it's the direct midline, on the lingual aspect, it is 5 millimeters from the CEJ to the furcal crotch. So when you know those root trunk lengths on the mandibular molars, you can be mindful when you are probing. Do any of your depths extend past the level of the root trunk? That is important for you to be asking that question because we know that the risks of why we're looking at that disease progression is important because that will really set your patient up for challenges. On the maxillary molars, there's a little difference in the furcation. Because you have 3 roots, you have a mesiobuccal root, a distobuccal root, and then a lingual root. It will develop 3 different opportunities on that tooth to have furcation involvement. Now, because on the mesial aspect, the shortest part of the root trunk is lingually placed, it means that the area that you want to focus your attention on for the mesial furcation is on the lingual. So that would be the space between the lingual root and the mesiobuccal root. That furcation involvement, that root trunk is only 3 millimeters in length. So if you are measuring with your probe on the mesiolingual surface of tooth number 14 and you get a 5 millimeter pocket, that should heighten your awareness of that area because it is only 3 millimeters between the CEJ and the furcal crotch. The next furcation area on the maxillary first molar is on the direct buccal, and this is centered in a mesiodistal direction. It is 4 millimeters from the CEJ to the furcal crotch. And that is much like the mandibular molars, okay, because it is centered and there's two buccal roots there. The next complicated furcation area on the maxillary molars resides on the distal aspect. And again, that root trunk length is lingually placed. So in order to determine the furcation involvement between the distobuccal root and the lingual root, you would have to measure the probe depth on the distolingual surface. So when you probe into the distolingual surface, your root trunk length there is 5 millimeters. If you have a probe depth that extends beyond 5 millimeters, you would have heightened awareness that there may be furcation involvement there. The good news about the maxillary molars is that the root trunk lengths on the maxillary first and second molars are the same. Whew, right? So, maxillary molars, I will review again: mesiolingual furcation, 3 millimeters, direct buccal furcation, 4 millimeters, distolingual furcation, 5 millimeters. For the mandibular molars, there's a buccal furcation on the first molar. The root trunk length is 3. There's a lingual furcation. The root trunk length is 4. On the mandibular second molar, the buccal root trunk length is 4, and the lingual root trunk length is 5. This seems to be very challenging for students to visualize. So I would say if you took your typodonts and really sat with it and looked at it and really understood the root trunks, it would really go a long way to helping you understand how oral anatomy and instrumentation go together with perio in the clinical setting. This requires a lot of critical thinking. I'm not going to lie, but I will tell you that root trunk length is a subtle but critical factor in periodontal diagnosis. And as a hygienist, you face some real world challenges when you are trying to assess it. Because access, right? It's really hard. You have limited visibility and the tissue and inflammation can be in your way. And then you have to make that determination of whether or not there's gingival, like a pseudo pocket, or real clinical attachment loss in those regions. And then you have the anatomical variability to consider. So these root trunk lengths for you are a benchmark to heighten your awareness. And there is cone beam technology, and that does offer more detail, but it's not always available to every clinician. So you don't want to just rely on that. And let's not forget that in all of this part of the assessment and talking about root trunk lengths and periodontal disease assessment, you have patient factors involved, right? There's discomfort, there's limited ability for patients to open, maybe they have a gag reflex. Think about all the things that can interfere, just visibility, all the things that can interfere with our ability to assess the mouth. Oh, I got to tell you guys, there is a probe, the Montana that PDT came out with, and it has like a bend in it. That has been a game changer for me on the maxillary posterior teeth when I am probing. I can't believe that we did not think to put a bend in the actual probe all this time. It was, like, crazy to me, but, the first time I used that, I was like, "Oh my gosh," it just makes access so much easier and ability to, especially on the distals, ability to get into that region and be confident in the probe depth that we have. So When we are treatment planning, we want to have confidence in our assessment outcomes. And so, for those things, it's really important for you to know the foundational pieces. And I know that when you're looking at those radiographs, if you know those root trunk lengths, like the back of your hand, in your heart, and in your head, it will go a long way at helping you. I will tell you that the next stumbling block students typically face is when they're actually trying to chart that. So when you put those numbers, your probe depths, on the actual chart, and then you go back and you look at those numbers and you say, okay, which one of these areas should have hyper focus on? So if you're just looking at your probe depths, you should be able to say, I should watch that area or recheck that area or look at that specific area on the radiographs because of what the probe depth tells me. And now you know, based on what I told you about root trunk lengths, that even if you have a 3 millimeter pocket, in some areas, it may be something that you still need to take a second look at or a closer eye. For example, the direct buccal of the mandibular first molar only has a 3 millimeter root trunk length. So if you have a 3 millimeter pocket there, you want to take a second look there. The maxillary first molar on the mesiolingual only has a 3 millimeter root trunk length. So even if you only have a 3 millimeter pocket there, you want to take a close look at that. Compare it with what you see on your radiographs and compare it with previous radiographs if you can to denote any changes that you may see in that region. These are vulnerable spots in your patient's mouth based on anatomy and access. And it will go a long way if you are aware of your root trunk lengths, you're aware of where are the vulnerable spots and what are the concerns that I have as a clinician when I'm trying to determine the risk level of my patient. I hope this was helpful for you guys. These are things that I see as challenges for students and for clinicians that are out in the field. So do not feel like you are alone in this. We're all in this, guys. We are all in this. And what's so important for you when you're doing an assessment in really focusing and being an expert on the root trunk lengths is that we know that the earliest detection of disease gives us the best outcomes. So have a really critical eye when you are working with your patient. Knowing those root trunk lengths really soundly will really help you with early stage 1 diagnosis because then you have great outcomes. I know for me as a patient, if I go in and the hygienist explains to me that maybe I have stage 1 grade B periodontitis, but then they go ahead and explain to me that it's not all just my home care, that some of it is my anatomy, and that I have this area, and they can show me on a model what is going on, and they can relate the disease progression to the anatomy. It makes so much more sense to your patient, guys. And it makes more sense to you when you're looking for it. So sometimes we have to just be really mindful of what we're focused on. So I hope this episode brings focus to you on your root trunk lengths and why it's important for you to know them. I hope you have a fantastic week. I'm always here to help you. Reach out if you need support. Reach out if there's content you'd like me to cover. I'm happy to share. I'm happy to help. And I hope you have a restful break. If you are on Christmas break and taking a little bit of time away from school, I hope last week's episode was helpful for you on resting and recovering. All right, take care.